I want to focus on food because this is something that you can really control. It's more important to just say to our listeners and our viewers, just have a clean diet. That's kind of hard right now, a clean diet.
If I eat the same amount of calories right now that my mom ate in the 60s, I am going to gain more weight from that. And that's because of the toxicity and the low nutritional content. And what has happened is that we have become more susceptible to inflammation, even from good foods. That's this concept of food sensitivities, distinct from an allergy. You're not going to immediately get hives or a rash or swell. These aren't immediate reactions. These are delayed reactions. They make us feel more tired. They make us gain more weight. They create an underlying inflammation that washes over your individual genetics and makes the areas that are weak in your body worse.
Welcome to Rethink My Health podcast and radio show, where each week we come to you live from our studios in Atlanta, Georgia, talking about chronic disease healthcare matters that matter most to you, your family, your friends, your loved ones. And as I say time and time again, they do matter most to us, the research scientists, the practitioners, the physicians in the trenches, day in, day out, researching and finding root causes for very complex issues. Sometimes it could be simple issues, but most of these chronic diseases are multifactorial causes and they're complex. What we're finding right now in our society is that looking for a quick fix is not the right answer. Finding solutions to real problems takes time, effort, and working cohesively as a team. At Rethink My Health, this show is about education, it's about wellness, it's about empowering you the patient, you the individual, whether you're a practitioner, whether you're a patient, whether you're just curious. This show is going to educate you and hopefully galvanize you to take action for you, your family, your loved one. That's what I'm seeing right now in our country. We're seeing a movement. We're seeing individuals that are not satisfied with the status quo. And that's what Rethink My Health is all about. We're not here to give you medical advice. We're not here to replace your practitioner, your family doctor. They're busy doing what they have to do. We want you to be armed with knowledge. And in today's day and age, we have a plethora of information out there. Some of it's good, some of it's so-so. But at the end of the day, you need to find an expert. And that's why I'm going to challenge all of you to seek advice from a functionally trained integrative practitioner at Rethink My Health, sponsored by Progressive Medical. This is what we've been doing for the past 27 plus years in Atlanta, Georgia, also across the country and internationally. I'll be introducing my guest shortly, who is a well-known speaker internationally, educator, and forward thinker about root cause medicine. So let's just jump into the topic today. And I want to welcome Dr. Cheryl Burdette. Dr. Cheryl Burdette is a board-certified naturopathic physician. She's an educator at Progressive Medical for well over 2.5 decades. And she's one of the co-founders of a specialty lab, Precision Diagnostics. And we're going to focus a little bit on diagnostics, specifically food sensitivity. I want to thank our sponsor, Progressive Medical, for Rethink My Health. I'm Dr. Gez Agolli, an integrated practitioner, doctor of public health, here to give you knowledge and awareness and bringing on very unique individuals to interview. Last few weeks, we had some great interviews. We've interviewed oncologists. We've interviewed other naturopathic doctors and other medical doctors talking about longevity. So today, we're going to focus on specialty testing. And one of the reasons why I chose this topic is that one of the main reasons that we've seen obesity on the rise, well over 100 million Americans, this is staggering, Dr. Burdette, got it from the CDC, 100 million Americans are now classified as obese. Yeah, we see a lot of these GLP-1s making an impact, but I want to put that aside for a second. We're definitely not against GLP. I think when it's done properly, it's very, very appropriate. But what happens when you get off of it, right? So it boils down to several different factors, and we're going to focus on something called food sensitivity, intolerances, inflammation, Inflamed obesity, I call it. So, Dr. Burdette, let's just jump right in there. First of all, thank you so much for joining us here on Rethink My Health. One of the first things I want to talk to you a little bit about is you've devoted your career to forward thinking outside the box. And I know that when you came to me well over 15, 16 years ago with the idea of putting together a laboratory for research, and one of the main focuses was food. I was taught in my medical education that food is your medicine, of course, and medicine could be food, which I totally believe. But sometimes that food could be also your poison. How does food sensitivities differ from food allergies and intolerances? I think there's a confusion there because a lot of patients come in and say, I ran my food allergy study, and then we find out it's an IgG. Can you educate our listeners and viewers what the differences are?
Absolutely. And that has been really the joy of Precision Point Diagnostics, is that we get to think about what's going to move the conversation forward. So when we began conversations about what do we need out there in the laboratory space, what we realized was that so many labs were designed for a diagnosis, which is important. We want to know if we have high cholesterol or depression. We're going to treat those things differently, of course, but the labs were not designed to understand root cause of what was going on in somebody, a process behind disease, things that increase inflammation that aren't per se the diagnosis, but make them worse. And so we thought about, these are things like low levels of nutrition or high toxic body burden, being under a lot of mental emotional stress, perhaps a lot of free radicals, but foundational is the nutrition that we get into our body and reducing inflammation. And some of the biggest ways that we become inflamed are the foods that we eat on a daily basis. And we see this in the literature. If I eat the same amount of calories right now that my mom ate in the 60s, I am going to gain more weight from that. That's what the studies show. Calorie for calorie, they're worse in our body today. And that's because of the toxicity and the low nutritional content. But in addition to that, and even because of this, what has happened is we've taken our food supply, we've coated it with things like pesticides, we've decreased the nutritional content, and what has happened is that we have become more susceptible to inflammation, even from good foods. And so you think, how could that happen? Well, that's this concept of food sensitivities that you just mentioned, distinct from an allergy. You're not going to immediately get hives or a rash or swell. These aren't immediate reactions. These are delayed reactions, 3 to 72 hours later. They make us feel more tired. They make us gain more weight. They create an underlying inflammation that washes over your individual genetics and makes the areas that are weak in your body worse. So it can show up as almost any symptom because it creates a stress in the body. And this is one of the reasons that initially people said, well, we don't do that kind of testing. It's not a diagnosis, but for us, it's everything. What's the reason behind the diagnosis? And if we can create the least inflammatory diet for people based on their own individuality, it just moves the health forward in terms of overall outcomes.
I think that's a great explanation, and I totally agree. And I've had some colleagues that are allergists, and I understand their position as well, because let's get a little scientific for a second, Dr. Burdette. We're talking specifically IgE. So a lot of allergists, if you went to your allergist/immunologist, they're going to either do a skin prick when they're going to be looking for IgE, and what Dr. Burdette is discussing is a delayed, which is an IgG. So it's two different components of your immune system. And yeah, your allergist is right because, okay, an IgE could be life-threatening, right? It can cause an anaphylactic reaction and other symptoms such as hives. However, from a chronic disease perspective, inflammation, we believe, is one of the gateways to all kinds of different diseases. Your body's constantly inflamed like a low burning fire. So Dr. Burdette, since you were mentioning this, and I want to stay on this topic of obesity for just a second, because I do believe that there's many ways to approach obesity, and inflammation is one of them. So really clearly delineating, let's talk about some of these chronic symptoms caused by delayed food sensitivity. So we have an idea, it's called IgE, that's immediate. We think it's important And that's why I know that you've put that on your test as well. But I want to focus on IgG, and then we're going to get into something really cool called complement. But I want to focus first on just educate and before you even answer that, take me back to the beginning of your medical career. Why did you get involved in this anyway from a diagnostic? How did you get interested in this?
Well, because you, Hippocrates, and myself are all on the same page when we talk about food is medicine. That is the reality, and we're going to eat every single day. I mean, you might fast, so there's some exceptions.
It's interesting you mentioned Hippocrates, who's the father of all medicine. I wonder if he'd be alive today, he'd be talking about this, because at that point, they didn't have adulterated food, right? Everything was free of chemicals, and so I totally agree with that.
Yes, but he even then knew that this was the way that we got well, and so if we can work on and people are going to eat every single day. Do we want to necessarily take medications every day? It would be desirable not to have to. It would even be desirable to not have to take supplementation every day either. But we have to eat every single day. And when you eat, that food encounters the inside of your body, the gut lining. And if I took your gut lining and pulled it and stretched it, it would be the size of a tennis court. And so it's an enormous amount of area. And so if every time you eat, we either inflame that area or enrich that area, it is literally an enormous opportunity to make things better. And so as we dig even deeper into the biology and the physiology of what's going on, when you eat a food, it creates irritation, many things get compromised. And first and foremost is the immune system. And so that could be colds or flus, or that could be increased risk of cancer. That could be increasing potential autoimmune conditions, from antibodies to your thyroid to things like Crohn's or colitis or rheumatoid arthritis. But anything where there's an immune imbalance starts in the gut. Why do I say that? Well, because we have friendly critters there, bugs, our microbiome, and this is the primary thing that stimulates immune system locally, something called secretory IgA, but also sends signals to the immune system in the rest of our body. So if you want a healthy immune system, you better not be eating foods that are irritating the gut. From there, we make neurotransmitters in the gut. We absorb all of our nutrition in the gut. And so it's really where the interface between the rest of our body starts and certainly doesn't stop. So if you eat a food that creates this type of reaction, not an allergy, but a sensitivity, IgG, that damages the lining. And the research says even IgG antibodies themselves will cut holes in your lining, make it more permeable. And as the lining becomes more permeable, things begin to drift in that shouldn't. Little bits of bugs, little bits of foods, and this ignites our immune system and creates ongoing inflammation. And like I mentioned, you might not feel that inflammation. It might be a headache, but it might not be. It might be more joint pain, but it might not be. Though that inflammation washes over your genetics and causes your weak areas to express themselves more quickly. It's a strain on the body. And so if we want to work preventatively, if we want to even reverse pathology, we have to take a strain off the system. That's lowering inflammation. That gets back to every food that you eat.
Absolutely. And that's a great explanation, because it is a strain on the system. And you know, a lot of individuals don't even consider, and I'm talking practitioners for a minute, don't even consider food sensitivities scientific, although they all know about IgG, which is delayed immunoglobulins. And it's interesting you talk about that, that a lot of these symptoms could be very benign initially and then turn to something very, very serious, all kinds of, because really this is focusing on your immune system. And as Dr. Burdette, you were mentioning that our gut lining is the size of a tennis court. Maybe some people are going to say pickleball because pickleball is more popular now, but okay, either one, pickleball, tennis court, it's massive, right? So you got to be very, very cautious what's happening there. And now we get into this inflammatory marker and something called leaky gut. Because I want to have this show focus on obesity, I want to just get right into these metabolic disorders. A lot of research I've done is that inflammation is the gateway to many different diseases. I remember about 20 years ago, Time magazine. This is before everybody was just on the internet. And we had the Time magazine. They had this massive picture of like a low burning fire in a forest. And they were talking about, scientists were saying inflammation is the major cause of the majority of all diseases. Now, these are a bunch of scientists that came together, and it really ignited a debate, a healthy debate, of course. And we're not just saying that foods are the only culprit, because we are big believers in bugs, infections, viruses, environmental toxicants, all of that. But I want to focus on food because this is something that you can really control. And obviously, it's more important to just say to our listeners and our viewers, just have a clean diet, okay? That's kind of hard right now, a clean diet. And that's why we believe if you don't test, you just guess. So Dr. Burdette, we're staying on chronic inflammation. Talk a little bit about how chronic inflammation and food sensitivity, I want to get into the metabolism disorders, okay? When I use the word metabolism, your metabolism is responsible for all physical and chemical activities, including the degradation of food, and it turns it into cellular energy, okay? So when we talk metabolic disorders, we're talking hypothyroidism, we're talking adrenal imbalances, and we're talking about, let's just stick with type 2 diabetes for a minute, not type 1, because type 1 is actually autoimmune and it could be a viral component. Let's stick with those three for a second, and you can throw in insulin resistance. How do the two tie together, okay? Because a lot of times individuals don't believe, they go to a doctor and they just say, oh, I'm just here for my diabetes. And then they just avoid, they're going to be put on metformin or maybe a GLP, and that could work, but they're missing such a major component. Tell us why.
Again, it starts with that inflammation that can lead to, for example, more weight gain, but it's the same mechanism that it causes more of these metabolic issues and cardiovascular issues down the road. So when you're eating that food that you're sensitive to, as I mentioned, it can create holes in the lining. And so, yes, that lets things flood in, but that also causes signals from our gut to get sent through the rest of the body, because the body says, oh my gosh, we're under attack. And so it turns on inflammatory signals, things called TNF-alpha and IL-6 and various inflammasomes. And now, if I go and look at most chronic conditions out there and say, is TNF-alpha increased in this condition? Are these inflammasomes increased? The answer is yes. And so, for example, when you increase those inflammatory mediators, one thing that happens is you gain weight. And I mentioned same calories, 30 years ago, don't treat us the same. Toxicity is one reason. But if you're eating something your body is sensitive to, it does the same thing. It creates inflammation, and that turns on a different hormone, one called leptin. And that will begin to cause us to store more fat tissue. So this is the perfect time of year to have this discussion, because maybe you made that New Year's resolution and you really dug in and you were faithful and you did the things and you were at the gym and you're exercising and making better choices, but still haven't seen things move as much as you would have expected. It could very well be that even your healthy choices have things in them that you yourself are inflamed by. And so it starts there, but also that fatigue, like I mentioned, your own genetic weakness. But those same inflammatory mediators can also cause us to be more insulin resistant. Those same inflammatory mediators can damage the inside of the vessel. And when you damage the vessel, you don't get oxygen delivery. And so this is why we start to see our diabetic patients have kidney failure and neuropathies. It's because the damage to the vessel not delivering oxygen like it should damages that end organ tissue, damages that nerve. But those same inflammatory mediators that can do that also cause us to be more fatigued, to not feel as well. And so it's this cascade of events that get set in place, yes, by the foods we eat, but if that food provokes an IgG response, that IgG antibody itself creates permeability that sets off an inflammatory cascade.
That's a great point. Hey, if you're listening for the first time or watching us, this is Rethink My Health. It's a forward-thinking show helping you get to the root cause, sponsored by Progressive Medical. This show is about education, and this is a great topic right now because, what's happening in our society right now is that a lot of Americans are being exposed to just jumping on these GLP-1s, which we think they're very appropriate for the right individuals. What we're saying, though, is just GLP by itself could be inadequate for a long-term strategy, okay? Long-term strategy. We do understand that there are some tremendous benefits, especially for metabolic disorders. But if you're not addressing inflammation, once you get off these medications, and we've seen it, we've had our practitioners at Progressive Medical and other colleagues across the country talk about this, and that's why they get into a situation where they prefer microdosing, and then they work on these other pathways. So just jumping on a Zoom call with a practitioner and them just prescribing this could be incomplete for a lot of individuals. So we're going to encourage you to do a little bit more research. If you actually hit the wall and you're not either losing any more weight or you're working out, just like Dr. Burdette said, it's very frustrating. And certain individuals from a psychological perspective just give up. And what is happening is this is the yo-yo diet effect, right? You do everything possible and you basically say, what's the point? Nothing's working. And that's why you got to take a step back. You got to take a step back and find out, is it really inflammation? Do I have leaky gut? Do I have food sensitivity? So let's just jump right in right now and talk about the diagnostics. Because we have a lot of those individuals that are listening to us right now that probably have never been tested for a food allergy sensitivity. What testing do you recommend? How does someone put this together? How easy is it to get this test?
So I recommend not having a forced choice. You mentioned their allergies. You mentioned their sensitivities. Looking at all of the ways that food can inflame us is quite important. And so you find a test that does all of that. I've been privileged enough to be able to work with scientists on the diagnostic team to develop a test from Precision Point. It's also offered at Progressive Medical. So reach out to Progressive Medical if you're looking for it. But this test doesn't say, let's only look at one pathway. It says, look, there are multiple ways that foods can inflame us. Let's look at all of those pathways at one time. Let's knock it out. Let's figure it out so that we're not looking a little bit at allergies, looking at sensitivities, trying to put a whole picture together. So at Precision Point, we developed a test that is the most expansive in terms of how it evaluates food allergies and sensitivities. And as we continue to learn more things, we continue to develop. So we look at IgE, those allergies. We look at IgG, sensitivities. We look at IgA, a different type of sensitivity that starts in the gut but can move into the serum. And then we look at these ways that the immune system can really be amplified. And those are pathways called complement. This is the only test that measures all three complement pathways. There are three. There are a couple other labs that maybe look at one or two, but we're really the complete gamut of what creates the most inflammatory response to foods. And so looking at this all together is really the way to get to the bottom of what diet is best for you.
So it's a simple blood test. It's also could be a finger stick. If you're watching for the first time and we're discussing this, is that there are a lot of different tests out there. Some of them are really good, some not. We're not here to discredit any laboratory. We just want to bring an awareness on why it's important to take a step back. A lot of family practitioners probably aren't going to recommend this. Some are becoming forward thinking. So we're basically talking about a comprehensive food allergy and sensitivity. It's all about gut health, and gut health has been on the forefront, and it's now being researched and established that's one of the key components to a healthy, balanced body getting back to homeostasis. If you're battling obesity, if you are on a GLP-1, definitely ask your practitioner about ordering a specific test to determine sensitivities. And if your doctor just said, just do the IgE, challenge them. Do your own little bit of research on these delayed sensitivities and do your research on a laboratory. Dr. Burdette's done a fantastic job with her research and her team. I know that they're doing other diagnostic testing. And they're doing something also called zonulin. We'll talk about zonulin in just a minute after the break. But hey, this is Rethink My Health, and this show is really talking about helping you take control of your health. And as Dr. Burdette said, she is a leader and a forward thinker, and she definitely has the ability to collaborate with other scientists all across the world. And this is something that we know is making an impact on patients' lives. So Dr. Burdette, we have a couple of minutes left before our break. I want to thank all of our loyal listeners on Rethink My Health. Whether you're listening to us on the radio or you're watching this on YouTube or a different platform, we thank you for supporting our show. We have forward-thinking guests periodically, and Dr. Burdette is assisting me in the research and putting together this podcast and information. Just very quickly, got about a minute and a half left before break. Tell us about a patient that you have worked with or a practitioner, because you train hundreds and hundreds of practitioners. Give me one example of how this changed a patient's life.
Well, one thing that's nice about being able to go over and educate all over the world is being able to hear stories from all over the world about how this type of testing has shifted people's lives. And so had the opportunity to lecture in Baden-Baden in Germany, and another practitioner from Spain was sharing with me an elderly gentleman who no longer had range of motion. He could not walk and move around, and his quality of life was so limited. And, they just thought of this as end stage, and that's the way it's going to be. But even in somebody older, when he was able to change his diet, which he began to see a decrease in pain. He began to see an increase in his activities of daily living, which means feeding yourself and going to the bathroom on your own, which might sound minimal to those of us who are doing it every day, but those are the things that really rob you of any ability to participate in life. So by changing his diet, he had quality of life added on that was immediate and that he could see and that he could actualize into having good golden years.
That's fantastic. And you know what? That is powerful information. And then when you change your diet, you change your life. And that's what's really exciting. But more importantly, when you don't test, you just guess. And that's one of the reasons why we're big believers. We encourage you to seek out a qualified practitioner to order some of these diagnostics and to get on that road to healing. Hey, this is Rethink My Health, sponsored by Progressive Medical. We're going to be back in a moment. Hey, welcome back. This is Rethink My Health, coming to you for our second segment here of a very exciting show, talking about food sensitivities, obesity, metabolic disorders, all-time high we're seeing right now. According to the CDC, we're seeing over 100 million Americans considered obese. That's 2 in 5 Americans. That's way too much. We're talking obese right now, like over a 40 BMI.
Right. That's beyond overweight.
This is horrible.
Yes.
And not only that, and we're not here to body shame you, of course. We're not here to say that. We're basically here to bring in awareness. And obviously, one of the major impacts of our society is that obesity is the gateway to numerous diseases, okay? One of the biggest problems that we're seeing right now is that you've got this visceral fat. This is the bad stuff. This is the fat that goes around the organs. And at Progressive Medical, I was very impressed with Dr. Burdette and his team of practitioners. When we went to a seminar, he convinced us to bring on a couple different devices that measure visceral fat. It's called an InBody, and we did something called a Staiku, which is basically taking a 360-degree picture of your body. It's bringing in awareness. It's not here about body shaming. It's about body awareness from an internal perspective. And this visceral fat actually is one of the leading causes of all kinds of chronic inflammation. And you have something called adipokines, which these are messengers coming from the fat that affect the body's ability and metabolism, one of the biggest things. And that's why it's so important that we find out root causes. And I encourage you to go to your practitioner and ask them to do these scans. Find out what your body composition is. You could be even a normal BMI and have something called skinny fat. And this is the bad stuff that's going all in the organs. And we're seeing it at all-time high right now. We're seeing non-alcohol fatty liver, all-time high. That definitely is going to affect how the body detoxifies, how the body processes nutrients, and how the body actually can restore. And we talk about this cell-to-cell communication. Dr. Burdette was talking earlier about the microbiome, billions and billions of bugs. We're supposed to have well over 75 to 80% of good bugs and, 15, 20% bad bugs. Now that's reversed, and that is causing these tight junctions of the gut to be permeable. And now you have all these different substances in the body floating in your bloodstream, and then your immune system sees it. And that's what contributes to other chronic diseases such as autoimmunity. So, Dr. Burdette, great first segment. I want to continue on the metabolic and the strategy. So take us back a little bit from the research as you've done. So a patient gets the blood test, comes back. To walk us through what happens at that particular time. Let's just say they find 4 or 5 different sensitivities. How does this work? How long does it take? What nutrients can be used in addition to this elimination? Do you eliminate these foods for life, or is it temporary?
Yes. So you've been working really hard. You made changes. You didn't see the progress you would expect. It could very well be that you're eating foods that you're sensitive to, and it creates inflammation that causes you to store more weight, store more water, and really just not feel like yourself, not feel your best. So now you get back your diet individualized to your blood, where your reactions are. And from this, what we really want to see is for people to come off of these foods for at least 3 months. And so many people have the misconception, oh, if I do this test, I'm going to have to come off foods. I have to be off of them the rest of my life. And that is actually not the case. The idea is to pull out foods for a period of time. It's a therapeutic diet. Use it as such. Pull those foods out for a period of time and then be able to reintroduce things with less inflammation. And yes, I don't want you eating a high sugary carbohydrate diet again, or not getting enough protein again. Macros, we always have to think about, are we getting the right fiber? Are we getting the right protein? Are we keeping carbohydrates down? But with inside that, now what happens is you're able to pull healthy foods back in. They don't create the inflammation anymore. And the goal is actually to have a more robust diet with less inflammation over time. This is particularly why I like working with Progressive Medical and how the practitioners here execute the testing. Sure, you can find tests online, that kind of thing. And maybe there's some support. Usually there's not. But what happens is people take foods away and they don't know when to bring them back in, and they don't know how to reintroduce them. And so it's half done. Taking the food away is only half of the work. What we really want is to build that gut lining and then to pull those foods back in to have the most colorful, robust diet with the least inflammation possible.
So basically we're talking about strategy here, and this is a strategy as well too, because just having a test, you have to have someone that knows how to interpret it as well. Depends on your symptoms, and depends on how inflamed you are. And there's certain individuals. And what I found in my research and working with other clients and other practitioners teaching them this tool is that, number one, it's very individualized, and this takes discipline. But the discipline is that you have a testing report from a CLIA laboratory that's certified. And it tells you which particular food and food group could be causing inflammation, as opposed to someone just saying to you, stop eating eggs, stop having dairy, stop having gluten. Okay, it may work for a lot of individuals, and we're not saying that may or may not, but the reality is, what about all these other foods? What about all these other food groups? And we've seen individuals, I want to focus on an athlete that came in, can't mention their name, however, they were a professional athlete. And basically, they were top performing, and we ran this particular test, and a couple of our practitioners came in and gave this case study that this individual had reactions to avocado. Now, if I sit there and say to you, don't eat avocado, you're going to be saying, are you kidding me?
Healthy fat.
This is the most healthiest fat.
Potassium.
It is. It's a superfood. No doubt it's a superfood. But for this individual, okay, it wasn't. And this individual, just by limiting avocado, and there's a couple other ones as well, some nuts, that they were actually trimmer, although they weren't obese, but they became trimmer, lean, less water retention, and less bloaty, and actually excelled, better recovery. All of these things just by that one food. Now, what's interesting is that for a period of time, this individual was 6 months. They were then working with one of the nutritionists and naturopaths with Dr. Bouquet. And basically what happened was you can have that food once every 4 to 5 days after a period of time. Can you explain that process? Because I think a lot of individuals, they think, oh my God, I can never have this again. Why is it that once you eliminate, we're talking IgG antibodies. Can you tell us a little bit of immunology? Why are you allowed to introduce some of these foods in the future?
Yeah, absolutely. Because when we eat a food and it provokes that response, that IgG antibody itself makes holes or makes the gut more permeable. So now everything floods in, that ignites the immune system, and we have an unbalanced immune response. We can't fight the infections we need to. We run away in the wrong direction, like autoimmunity. We create inflammation that makes us more overweight, that puts us on a path for things like diabetes or cardiovascular disease. But when we remove the food, the IgG antibody goes down. And at Progressive Medical, of course, there's going to be further strategy, further coaching about what you can do to build that gut lining. As you build the gut lining, you put the barrier back intact. That barrier is now going to keep things from igniting the immune system. And so it's a 1-2. It's really remove the food, but then work with your practitioner at Progressive or your clinician, wherever you're at, to figure out how to build your gut lining. So when you bring the foods back in, it's no longer creating that inflammatory response. And that's absolutely possible. And that's probable because the body is wise. It wants to heal if we give it the nutrients it needs. If we take away the irritants that are breaking it down, it does what it's supposed to do. And so you put the immune system, you put the gut back intact. And now it's literally a whole different world when you reintroduce those foods.
Absolutely. I became a believer, Dr. Bett, probably 15 years ago when I was myself had some gut issues and basically ran the test, and my IgG and also part of IgE was off the charts for both eggs, right? So, basically I couldn't have egg whites or egg yolk, and I was very, very vigilant on not having those foods for about 6 months. Now I can have them occasionally, no problems whatsoever. The other big one for me was cashews, and I was eating cashews all the time. I love cashews, and I noticed joint pains and literally went away within a week. So this is powerful stuff. And that's one of the reasons why we wanted to devote a whole show, Rethink My Health, about the benefits of gut health and food sensitivity. There's definitely a strategy. So if you're suffering from a plethora of symptoms, if you're battling the fight of obesity, the battle of the bulge, whether you're on a GLP or not, you've got to take a step back and say, how is gut health? How is food sensitivities? How is this going to incorporate into my life? And that's one of the reasons why we're big believers in testing. You just got to find the right test. If you're looking for a test out there, just do an IgE. I'm not saying it doesn't have value, because it has some value from determining if you have anaphylactic reaction potentially, or hives or things like that, and work with your allergist. I think immunotherapy is fantastic, especially now that some practitioners are using this oral therapy of desensitized instead of injections. But we're not talking about that. We're talking about these delayed food sensitivities and intolerances that are contributing to all of this inflammation. And that's why a healthy gut restored properly is going to be the gateway from optimal health. And we're seeing all kinds of research right now collaborating that statement. Okay, Dr. Burdette. So we talked about the testing. It could be a simple blood test or a finger prick, and you're doing multiple food sensitivities, well over 300 to 500. Recently, you just changed it, right, to 132
Absolutely.
Different foods, which is fantastic.
And dyes and additives. So.
Yeah, that's fantastic. And obviously, you don't want to have dyes or anything in your diet, but once you see if you have a reaction to that, now you can know why you're actually feeling worse.
Absolutely.
And we encourage all of you out there to have a clean, healthy diet, but to find out what works for you. You're an individual creative biomaker. Everybody's totally different. One size does not fit all. All right, so now you got this patient, you're working with a dietitian, nutritionist, coach, and you're rotating the diet. Let's get a little bit into the common supplements to heal the gut, just basic stuff. What are you teaching your practitioners to do? Patient comes in, they've got obesity, and they've got a plethora of food sensitivities. What would be your strategy? Just give us a top 3 supplements.
So first of all, we want to get those foods out for a period of time. You got to remove the irritant. And then from there, I really encourage use of probiotics. And there's a couple reasons for that, at least. There's probably 300 reasons, but we'll stop after a few. And the first reason is because when you are taking a probiotic, at the same time you remove the foods, it trains your body to see that food as normal when it's reintroduced. And there's this brilliant study where they took kiddos who had allergies to peanuts, and they took them off peanut One group got desensitization injections, and we're probably familiar with that as a therapy. That's what you do in severe allergies. Both groups actually got the shots, but one group got a probiotic alongside the desensitization. So now we fast forward and we look at these kiddos 4 years in the future. The group that only got desensitization injections, only 4% could tolerate a peanut 4 years later. If you got the probiotic at the same time, 84% could still tolerate the peanut. And so what that says to us is doing these therapies, and we're not jumping to desensitization and needles. These are sensitivities. They're different. You pull the food out, but combining that with a probiotic trains the immune system to see that food is different, not just now, but long term, because when you shift the microbiome at the same time, then that tends to stay in place, continuing to send these signals in an ongoing way. So we're not allergic, so we're not sensitive. And so I really think that's important. However, it's not just any probiotic. So you want to work with probiotic strains that have good research and also have good identification, because you can't research what you can't identify. So take a look at what you're taking and see if your probiotic has numbers and letters next to it. One that I've really fallen in love with is Bacillus subtilis AB22. So that AB22, looking for things like HN019, those things, they sound like a little license plate. So look for that next to your strains of probiotics, because if you see that, you know you're working with one that's really high grade, that's very much been identified. And so when we say these things about shifting how the immune system sees a food, we know it's that strain, that strength, and has exact data. Because otherwise, it's kind of like looking at different olive oil, for example. You could have a first press virgin olive oil, or you could press it and press it and press it. What you have at that fourth press is still an olive oil, but it probably doesn't have a lot of the antioxidants. It's been heated more. So you could have Lactobacillus acidophilus, but do you have one that's been identified? Because there are different strains and different grades that do different things, adhere to the gut lining. So for example, at Progressive NutriCare, when I look at what's used here by your clinicians, I can see they're selecting for strains that are identified, that are researched, that will bypass acidity of the gut. What if what you take just gets eaten by the acid in your stomach? It doesn't do any good as it gets further down. So specifically research to resist acidity of the gut, to resist enzymatic changes, to resist even antibiotics. And you might think, well, that's, who cares? I'm not really on an antibiotic very often, but your food supply is. So really being sophisticated about the probiotic we choose will give us these lasting results, but in a much more meaningful way if we choose something that's data-driven.
That study's fantastic, and that just proves exactly what we're talking about. There's a couple points that I want to bring up that you just mentioned. First of all, probiotic. Probiotics have been heavily researched, and for years and years and years, I was talking about, if I only had one supplement to take, I always talked about something called CoQ10, which is fantastic in itself. But now I've shifted because I think it's probiotics is one of those, because once you correct the microbiome, a lot of other things just kind of fall in place. And at Progressive Medical, we make available research-based nutraceuticals. Not every patient has to purchase supplements from our store. We just make it available for convenience because we've spent all this time researching. However, we challenge patients that if they choose to buy something online, that here's the one requirement that we ask them to do. We ask them to contact the manufacturer and get the certificate of analysis, because we want them to prove what is actually in there. And also, is it free of heavy metals and chemicals? We're seeing an all-time high. A lot of these products are unregulated and they are adulterated. And that's why you have to ask these manufacturers for the certificate analysis. I know at Progressive Medical and other functional integrative doctors and practitioners that use reputable supplements, because supplements can get a bad name because you can buy it. We had patients coming in that were buying stuff and Dr. Bouquet tested them in heavy metals and they were off the chart with lead, and because of these particular supplements. So please, I implore you to contact these manufacturers, get their certificate analysis, and make sure it's. But getting to the probiotic. Pro basically means advanced. Biotic, bio means life. Probiotic is the advancement of life in your gut lining. And that study is exciting. With the peanuts, it's fantastic. Wow, that's a major shift, only 4%. And once again, I'm all for immunotherapy, retrain the immune system, but it's obviously clear that changing that gut microbiome makes a tremendous impact. Okay, so that's one, the probiotic. What others? You got the food rotation, you got the elimination for a period of time. It could be a month, 3 months, 6 months, depending on the severity. Give me 2 more supplements that you think could assist in that healing process. Because yes, eliminating the food is part of it, but I think it's incomplete if you don't look at other, and I know it's individualized, but just give me some generality.
Yeah, so I also really like something called immunoglobulins. And immunoglobulins come from the immune system. For example, when a baby is breastfeeding, that passive immunity that we talk about comes in the breast milk in the form of immunoglobulins. And so when a baby is breastfed, we know that decreases their potential for having allergies or sensitivities. It decreases their potential autoimmunity in the future. It helps their immune system to fight infections. We know that it's one of the key things that we can do to stabilize immunity, even lifelong. It turns out those same immunoglobulins are not the exact same that are in breast milk, but we can extract immunoglobulins from colostrum, so bovine, dairy, milk. We can also extract immunoglobulins from egg sources, like something called IgY. And that's one we work with a lot at Progressive because that IgY has been trained. So when it gets in the gut, it does a number of things. First of all, it gets rid of bad flora, bad dysbiotic bugs, and those can continue to create inflammation that causes less acceptance of our foods as well. But those immunoglobulins, they will increase the local immune lining. And it turns out 80 to 85% of our immune system is in the gut lining. The third thing it does is these immunoglobulins, they say to some immune cells in the gut, they're called Peyer's patches, and they're where immune cells go to grow up and mature and make good decisions. So when this Peyer's patch sees the food with the immunoglobulin, it's like breastfeeding. It says, oh, this is normal. This is supposed to be here. So if you take away that food, what we want to do is when we reintroduce it, we want the body to see it as normal. So if you get on immunoglobulins while you're off the food and stay on them while you reintroduce, it creates the situation where the body says, yes, this heals my lining. I'm making good immune function. And now when the food comes back, I'm fine with it. I recognize it as normal. So I think that that's really changed. And that's what's really nice about doing the testing here at Progressive Medical is when we began to introduce more immunoglobulins on follow-up testing, you really saw people fall into the normal at a much faster, much more aggressive rate. And so it was rewarding.
That's exciting, Dr. Burdette. And so we've got probiotics, immunoglobulins, which is a fantastic strategy. And I think that you're retraining the immune system because ultimately the goal is to have diversity in your diet, okay? And to go back to enjoying some of these foods, not to be so restrictive, but also when you're sick and the body's inflamed, you've got to be very proactive in addressing this issue. Okay, so I asked for 3. Let me just say this because we only have 2.5 minutes. Let me just say these are great suggestions. I'm going to add something called enzyme. And one of the reasons why I personally like enzymes are catalysts. And enzymes help break down these nutrients. And without enzymes, the body's not going to be able to digest. There's an old saying, you are what you eat, but that's not true. You are what you digest and assimilate because that's how you get nutrition. That's how you bring in the body to get essential amino acids, essential fatty acids. And it starts with that enzyme that creates as a catalyst to break down, and you get these minerals that are cofactors. So those are the top 3, and these are general ideas. We ask you that you could go ahead and work with your practitioner and get that. And I challenge all of you, if you're going to buy supplements online, there's some great companies out there, get a certificate analysis or find a licensed practitioner that actually is certified in functional integrative medicine, and you can get quality supplements at Progressive NutriCare. That has been our philosophy from day one. Certificate analysis, have the best of the best because your body is worth having the best nutrients in it. Dr. Burdette, we only got about 1.5 minutes. Thank you so much for educating our staff. Last question. I know that you've given us all these steps to restore a healthy gut. Let's talk about one last piece of advice question, retesting. When should a patient retest a stool? And I was very individual. Give me general right now, because is it a one and done, or how do you work that?
Well, no, we'd really like to see what foods your body's still reacting to. So I suggest take them out and then work with your practitioner to go through what's called a challenge phase, where you bring them back in one at a time and see how you feel. And then you want to retest. So probably by the time you've done all of that, you're really looking at around 6 months to 9 months for a retest, but around 6 months, because you'll be able to see now, once you brought the food back in, is your body still reacting to it? And that's really the question we want to answer.
This is very exciting. Hey, this is Dr. Cheryl Burdette. She is an expert. She's an educator. She's taught thousands of practitioners across the world how to rethink gut health. Take action right now. Dr. Gez Agolli here. Thank you for being here, watching us on YouTube or one of the other podcast platforms, or listening to us on the radio. This show comes in every week from our studios in Atlanta, Georgia, to educate you, to empower you to think outside the box. As a matter of fact, integrative doctors don't have a box, and we're constantly researching. Take gut health seriously. I have a gut feeling you guys are going to do it. Have a great day. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bone. Thank you, Dr. Burdette. I really appreciate you coming on Rethink My Health. Next week, we're going to be talking about more forward thinking. We're going to be challenging oxidative stress and certain chemicals and heavy metals. God bless you. See you later.